as we kind of come to a wrap here, I hope that you have found the conversations today to be meaningful and fulfilling, creating the space for a lot of these policy discussions really is at the core of what State of Reform is trying to do. You're going to get an opportunity after to provide some feedback. I would really encourage you to do so. Just take a minute and let us know what you liked, what you didn't like, what you want to see more of or less of, how the salmon treated you, etc. So I would encourage you to do that. The other thing that, just as a matter of housekeeping, there is a reception afterwards, fancy snacks and some adult beverages, courtesy of Carolyn, that really is meant to be the button up the hallway conversation, right, that started in between sessions and ask those questions that you didn't get to ask the presenters. And for those of you who will stick around, we'd love to host you there. In interest of time, I think that I would love for my fellow panelists up here to be able to just kind of introduce themselves in the case that you aren't aware of where they are in the political and policy landscape. But in doing so, I would also invite them to kind of offer up what energizes them, what gets them up and excited in the morning, just as form of introduction. And Senator, I'll start with you.
Hello, I'm Nathan Johnson. I'm happy to be back at State of Reform. I've been here a few times. It's one of those places that's trying to reform healthcare, as are the rest of us on this panel. What excites me in the morning to get up and go to work, I care about everything I do. It's the biggest luxury of being in office. It's not the food, it's not the pay, but as you wake up every day and you go to bed every day really caring about what you do because it affects the lives of 30 million people, and healthcare in particular is one of those spaces that we do as a state incredibly well in some respects and incredibly poorly in others. And the biggest deficiency actually is in, we have this world-class healthcare and many people who don't have access to it. And that's, I know what we're out up here talking about today, but that is one of those things that gets me out of bed, is trying to think of ways that we can put in motion the forces of this sector to finally advance closer than the distant 50th we are in terms of access to healthcare. So that's my positive introduction.
Very good, Luis.
Thank you, Senator. Appreciate it. And thank you for the invitation. My name is Luis Figueroa. I'm the Chief of Legislative Affairs for Every Texan. You may have known us by our old name, the Center for Public Policy Priorities, or the C of Too Many Ps. So I am, first of all, to say I'm excited to be here with such distinguished group and with the Senator. You may have heard a couple of our staffers talk earlier, Brittany Taylor and Rachel Cooper, who are true experts on these fields. But for me, it's a personal issue. I grew up in El Paso with a single mom who struggled for health care access. She had insurance, but even with the insurance, it was a constant struggle for adequate access. And unfortunately, I lost her in 2014 due to complications from diabetes. And so to think that a person who with health insurance still struggled with access to health care, I think of the community, whether it's in the remote parts of our city, whether it's rural, whether it's El Paso, or whether it's the urban centers, we have families struggling with access to health care. And so for me, it's about the people. It's always about access to health care, access to education, and access to be financially secure. And that's what Every Texan is about. So thank you for having us.
I think on that note, obviously the themes that we've seen throughout the day, behavioral health, IT and innovation, access and coverage issues, they obviously have overlap, dramatic in some cases, but whenever we talk in generalized terms like coverage, right? Coverage can mean a lot of different things. My coverage is different than your coverage. My needs may be different than yours, right? And so, in these generalized themes, it really is important to get down into that detail level to see where change is really needed. Obviously, affordability is one of those issues that has riddled healthcare since the beginning of healthcare. how we've made some design decisions and things like that have sometimes helped and sometimes exacerbated that issue. And so I think with that, I'd love to hear your thoughts on really where affordability and some of the progress is made and where some challenges still exist for Texans.
Sure. I guess somewhat ironically, the most powerful tool we have right now to make healthcare more affordable to people who currently can't afford it is not actually by lowering costs, but with federal subsidies. Now, we do want to lower costs, don't get me wrong. Gosh, if someone cuts that soundbite, it would sound bad. But what we can do immediately, I mean, reforming systems and bringing down costs, that's over time. Hopefully we are working on it today. But right now, and I want to acknowledge the work that Charles Miller has done with Texas 2036, with trying to bring about federal subsidies to people who don't even know they're there. We have managed to get, I think the stat was 350,000 people health insurance, working Texans, low income, as a result of a bill that I passed in my second session, so the 87th legislative session. But we've got another 5.5 million more that don't have coverage, and we think that maybe we could get another million, another 2 million, close to free health insurance coverage. It has this high cost, but people don't know that they qualify for federal subsidies. They don't know how to apply for them. They can't get through the interface. There's some fairly easy fixes, logistically easy fixes, and then we get to the political part, that will make healthcare more affordable merely because we have subsidies that help people pay for access to insurance. And that's just before we even get to reforming the healthcare system in general. But I think it's an important point.
Yeah, absolutely. So I'll start with some of the positives, because I think we have a tendency, particularly at our organization, to focus on what we need to get to. But there are some positives, and I think one of the positives is the ACA marketplace. We are in a boom under the ACA marketplace, largely because of federal subsidies. We're covering about 2.4 million Texans, and people are being able to get access at $10 or less a month in some cases. This has been a huge boom for Texas and a very successful new emerging access point for coverage that didn't exist before the ACA, or didn't exist in the way it does before the ACA. The other thing that's working is, we've had some positive reforms legislatively, thanks to the work of Every Texan, Texans Care for Children, and a lot of the other advocates here in this room, being able to get to 12 months continuous coverage for maternal mothers. And previous to that, we had a 12 months continuous coverage for children, and on the federal system, we were able to extend that to 12 months continuous care for children. And this removes a lot of those barriers, and that's what we're seeing in our healthcare system. A lot of these procedural barriers to healthcare. It's not that people are ineligible, it's just the red tape processes that are restricting people from able to continuing their coverage. And so with that, I think I have to say a little bit about some of the concerns. And the concerns right now in Texas are the unwinding process. We lost quite a bit of folks in the unwinding process from April 2023 to January 24th. We lost about in total, about 33% of those who lost Medicaid actually had their eligibility checked. And in that, we know that about 80% of them involve children. And of those children, we know about 2/3 of children Medicaid are Latino, and about 15% are Black. So the unwinding process in Texas in particular was devastating to Latino families and families that rely on Medicaid access. So we're going to have to start repairing some of that damage in the next session. I hope we can start talking about processes to remove some of those barriers, to get people back on the rolls in an expedited process. And I'm hoping those conversations will have some real meaning next session in light of the unwinding process.
And I want to pick up on this idea, what Luis is appropriately talking about. We could use that word that scares people, equity in healthcare. But equity comes into costs. You all know it's very, very expensive to treat sepsis. It is not expensive to treat a urinary tract infection. But someone without access to the healthcare system may wait until their urinary tract infection becomes an acute condition that turns to sepsis, and then they're in the hospital for a long time if they survive. So by failing to invest in some things that can be viewed as social causes or equitable access to healthcare, we are creating costs for ourselves. So we can talk in some other conversation, maybe this one, about the cost of treatment for an acute condition. But why are we getting there? I think we spend a ton of money that we don't need to spend trying to ameliorate sometimes tragic conditions that should never have gotten there. Access is also about cost.
So I think there are two things that I'd really love to, two threads, if you will, I want to pull on. One being conversation around healthcare.gov, a little bit of the crystal ball into next session, and is there momentum there for either changes, whether it's state levers on the policy front or even the conversation afoot about a state-based marketplace. So that's one. The other would be, from your perspectives, do you feel that the largest need in some of these populations, earlier conversations today around eligible but not enrolled, obviously the unwinding has had this impact of folks who are likely eligible for services who just aren't enrolled. The same is true for the marketplace. User interface, administrative burden, fear or knowledge base, right? Not being up to snuff. So first question, do you feel like that there is momentum for movement to additional reform for the marketplace in Texas?
I'll go out on a limb and say yes. I think there is a great desire to see us improve in Texas, and it is bipartisan. There's plenty of ideological obstacles to making progress, but things like a state-based exchange poses risks. It could be done poorly, or it could be done really well. The savings could be used, it could be blown, or it could be spent on better IT systems, or more employees, or paying state employees more for these services, or hiring health navigators or promotoras so that we can make sure that people have access to health care. I passed a bill last session that actually changed the way MCOs could be reimbursed for the hiring of health navigators. We need to do more of that kind of thing because a lot of the problem is lack of information. You know, what I'd love to see the legislature finally do is pass a health literacy bill. Doesn't even have to be the 3 that I've filed in 3 sessions. It could be someone else's. But when people don't understand the system, they can't access it, and it generally leads to poorer health outcomes and higher costs. But I think maybe the opposition is fading as we run out of quick fixes to fix our healthcare system. I think people are starting to realize that the healthcare space is necessarily an intersection of individual needs and advocates and industry and government. And by industry, I mean the healthcare industry. It is necessarily a space that we as a state have to occupy. And there's been some resistance to that, like, oh no, hands off. No, you can't hands off in this. I mean, we can screw markets up or we can make them work, but it does require our involvement. The whole system is run with the intersection of those 3 interests, and we have to participate. I think the reticence to go there is fading as we're realizing we have a problem on our hands, and at the same time we have an opportunity to make such a difference in people's lives with small changes. Huge changes too, like Medicaid expansion, which we haven't even talked about yet. But with small changes, we can make a big difference as well.
I appreciate that, Senator. So I'll start with the HCA. So, from our perspective, we'd be cautious about Texas doing it the right way. We have seen that without the proper funding, without the systems in place, that we could be putting at risk the one thing that is going very well, right? We have a huge boom. We've seen a huge increase in the number of people accessing healthcare through the marketplace. It may not be the best time to start turning that over to a state-based system, and will it be run by vendors that are trying to cut costs, or will it be run by programs that will actually be accessing it for the right reasons? So we're a little bit cautious on that side, but I do agree with you about some of these smaller reforms. I remember Representative Coleman, had a bill to provide for a Department of Health Equity that would look at some of these programs and provide for a state look at equity in our healthcare system. Health literacy, as you mentioned, is another one. And of course, the big one, which would, as you touched on, would address all of these issues in a meaningful way, of course, is the bill that you have, the Live Well bill, or other plans to bring in that 90% matching funds under a Medicaid expansion program. We had a majority of House members sign on to that bill 2 sessions ago. We have Republican sponsors for it. There is bipartisan support. It polls at well over 70% across Texas. Rural hospitals are in desperate need of it. Like, all the things are there for us to do it. We just can't get past that political threshold, and it just doesn't make sense for policy-wise why we haven't gotten there.
It's been disappointing because it does so much. There's nothing else we could do that comes close in scale. We're talking 1.5 million people. There's a lot of other things we're doing that are good. But we're going to talk about mental health. I'm sure something that's not frequently discussed with Medicaid expansion is that nationwide, the expansion population, generally about 1/3 of them have first-time access to mental health care, and 1/3 of them are availing of it. It's not just that 1/3 of them needed it. I mean, that's a population that's living under some stress. So there's yet another argument for us to expand Medicaid. We are kind of slamming into a political brick wall that my head is scarred at this point. But we'll keep hitting it. I had other thoughts, but I'll wait for the question.
So one of the trends that to your point about how do we avoid acute outcomes. Another thing, the jury is back right nationally on one of the things that helps create healthy children is healthy parents. So obviously expansion is one of those that that those children who are on Medicaid lots of times have parents who are uninsured, fall under that subsidy gap for the marketplace.
And we have seen a statistical correlation between enrollment of eligible kids in CHIP and enrollment or non-enrollment of their parents.
Right.
That parents who are covered are more likely to go get their kids' coverage.
Right. And so there's literacy elements to that you touched on, and I think that's great. I do want to move to mental health. It's obviously a space that nationally is getting lots of attention and funding and priority, especially around certain populations, think maternal health and others. It is definitely it has an equity lens to it, and would love to hear just thoughts or hopes and dreams for reforms. And
yeah, so I'll just start where we always started at every Texan. That's the budget. We have had 2 sessions here with historic surpluses. We're anticipating another one next session. We've heard from the governor that he anticipates another record-setting surplus. And it's time to put some of those funds into needed programs. And one of those is mental health. We consistently hear both on the education side, on the health side, on the city and county side, that mental health is one of the biggest needs in the community to address a whole host of issues. And so that's where I would start. Let's start putting our mouth, or our money where our mouth is, so to speak, and then actually start funding some of these programs that are well known to have positive impacts in communities and that have been modeled in other states. But for us, it starts with the budget, and I think we have an opportunity here next session to really put some money into it.
Yeah, and the last couple of sessions, the legislature has put increasing amounts into mental health, and that's great. And so it's still kind of staggering when you look at what we're doing relative to other states, and it's low. It's low in the amount we put in per capita, and it's low in terms of the access that people have to the number of service providers, the types of services. So it is definitely an area where, again, I almost always agree with Luis that we ought to be investing in that. And politically, all this stuff is difficult, and doing anything in politics is hard. But politically, what is the sell for putting money in this? And I like to think of health and mental health, which is sometimes oddly a subcategory of health. That's infrastructure. And so when we're talking about surpluses, we are building the infrastructure for the future. Infrastructure can be physical, it can be roads and power lines and IT systems, water reservoirs, but it can also be social, which is education and healthcare, and that's just as much your infrastructure. And I think if conceptually we can think about healthcare as infrastructure, it, I think, opens up people's minds a little bit to taking a massive surplus and applying it to the infrastructure upon which we're going to rely for our future. And I hope we will develop that attitude towards it.
So we've got about 10 minutes left. I want to prime the audience to start thinking of some questions, and time allowing, we'll go to that. But just as a form of wrap up, do you see, or what are the things that you anticipate in the next 12 to 18 months where there really is some opportunity to take advantage of, but then on the flip side of that same coin, what are the things that are really concerning to you that kind of could come about in that same time frame?
So one thing I'm pretty optimistic about is continuing the work we did outside of Medicaid expansion to increase awareness and access to health coverage, because the money's already there. The systems are already there. Whether we do a state-based exchange or continue with the federal run one, there are ways for people to get health insurance, and I think we could get hundreds of thousands, if not into 7 digits, people insured just in the next couple of years if we do this right, and I'm really going to be pushing that. Another big element that we haven't talked here about today that I don't know what the chances are short term, but I know that it's bipartisan to some extent, and that is social determinants of health, and I think you're not supposed to say social in Texas, so non-medical drivers of health. Call them what you will, but again, we create our own costs very often by not attending to certain elements of life that have medical consequences. And we are talking about nutrition and access to food. We may be talking about transportation. We may be talking about housing. In some degrees, mental health care is correlative to the need for physical health. So if we can start thinking a little more holistically about health, I think we can improve quality of life while lowering costs. Tom Oliverson had a bill out of the House on food as medicine, and I was the Senate sponsor of that bill. I also had an in lieu of services where we can use Medicaid funding to address non-medical drivers of health, social determinants of health. That's an area where I think there's a lot of possibility, and I'd like people like Tom Oliverson and I to be able to rally people irrespective of their political ideology to get behind.
Good. Yeah. Luis?
Yeah, for us, I think it really centers around the unwinding. We're looking forward to some hearings to uncover exactly what had happened, some of the processes that were involved. Not to get too technical, but there's the ex parte reviews that were happening through administrative processes that, there's existing data that was already in place that we could determine the eligibility for folks that HHSC wasn't able to use or wasn't allowed to use in order to qualify people. And so we're really interested in getting into the weeds on that and discovering what we can do. And the reason for it is twofold. One is we have a backlog that is now spilling over into SNAP eligibility. And two, we have just a shortage of staff and resources at HHSC. If we could remove some of these red tape obstacles and get into the processes of how we evaluate eligibility, we might be able to reduce that backlog, address some of the SNAP concerns, as well as provide relief for an agency without the huge costs of having to build up a huge amount of new staff and new technologies, which may be needed as well. That's the other option, but I'd certainly like to see us consider new and effective ways of reducing kind of the red tape and bureaucratic systems for the advancement of getting people back on the rolls.
And I actually filed a bill to do that.
There you go.
And it failed. But we can try again. And listen to what we're saying here, reducing red tape.
Yeah.
I mean, we can actually make the regulatory system work better. And we are also talking about the budget surplus. And yet we have antiquated IT systems in many cases, agencies that are understaffed. I think it's time to invest some of that money in systems and people as well that provide the services that we need. And when we don't provide those services, it costs us more money later. This is starting to sound like a theme.
On that, and as you brought up budget and surplus, and obviously budgeting at the Capitol looks very different when you have surplus as compared to when you have deficit. Do you have a sense, or where have the conversations been that you're privy to as to what some of those priorities are? And again, like you've got an audience of advocates, where is good, bad, or indifferent? Where do you think some of those priorities fall with that surplus?
Do you want me to start?
Do I need to turn off the recorder for this?
I'm in trouble with that one.
Well, I'm just going to say, we work on a multitude of issues at Every Texan, and so one of the things that we're going to be launching in this interim is a people's budget. And the people's budget is a discussion about how do we grow the pie instead of splitting the pie up. And I'll tell you right now, a big chunk of pie is being spent on border security and on tax cuts that are sometimes obviously needed when we talk about homestead and relief for certain families, but sometimes not needed where we are, providing a huge boon to a company that's already a Fortune 500, a billionaire company that may not need as much of a tax cut as the elderly couple down the road. So I think we can take a look at some of those priorities that have been priorities in the past and start thinking about it a little bit more holistically. What are we giving up by doing that? Are we failing communities, particularly rural communities, when it comes to rural hospitals? Are we undermining public schools in certain areas of the state because we are so determined to fund certain things and not other things? And that's really the focus of our people's budget, is to really take a holistic look at the pie and see how we can grow the pie for all of Texan, every Texan, instead of just a select few. And so I'll leave it at that.
Yeah, we had the $18 billion property tax reduction, and I voted for it. And I think we could afford to have done some property tax reduction. I just thought it was way too big. And I thought we should have invested more of it in health and education and physical infrastructure. So I think next time around, I'd like to see us put billions more in water infrastructure, clean, safe water supplies, as well as some other physical infrastructure, as well as public education. So I don't know what they're going to do. Frankly, this round of primaries, it gets super political, but I think it's going to be a difficult political environment to do sensible things next year. There are people on both sides who are going to try very hard to steer us in that direction.
Questions? We've probably got time for one or two, but I'm not afraid to adjourn us 2 minutes early. Going once.
You may have incentivized no questions.
Going twice. You guys are too courteous. This man has a primary. You can put him on the spot right now, and you're foregoing the opportunity. Unbelievable.
They're being kind.
They are being very kind, and they know that there's cold beer waiting for them right outside the door. Please join me in thanking Luis and Senator Johnson for their thoughts today. Again, as a form of adjournment, we at State of Reform really can't thank you enough for what you bring to these conversations, the energy and the passion. We believe that it's contagious, and thus bringing this group together and creating the space for it is just nothing but good karma. Now it's your job to go out and infect the rest of the state with some of the stuff that you've picked up here, right? That's tongue in cheek, but it is. So much of what we have talked about today really is around awareness and education. So we hope that you have found this to be a fulfilling program, and with that, we stand adjourned.